So today Dr. Pranaya, she is a physiotherapist, is presenting us with some more knee strengthening exercises. Let's get started and sit comfortably, placing your palms down without shrugging your shoulders up. Both the legs straight in front of you. Now let's look at the action. Flex your feet, toes pointing towards your belly button and extend them forward. Squeezing your glutes when you're flexing your feet and extend them forward, squeezing your calf muscles. So as you can see, this is working on your quads, hamstrings and your calf muscles. And when we say knee strengthening, what we mean is to strengthen the surrounding structure of the knee joint. So let's look at the causes. One is degeneration. Major condition in degeneration is osteoarthritis, can be acute or chronic, mostly seen in senior citizens. 2. Overstress on knees. This could be due to improper exercises and lifestyle. And 3 is overweight and the 4 is injuries. So this is one simple exercise. Let's move on to the second exercise. Lie down comfortably. Now those who cannot sit on the floor, you can lie down on a bed with a firm mattress. Right. Now the leg that is painful, let's see if it is one leg, what we can do, relax one leg and the painful leg, we will drag the heel towards the hip, flexing your leg, squeezing your quads and extend it forward and continue doing this action for 10 counts. Focusing on breath work. Inhale and exhale. It's a smooth and slow action, no rush. Allow the muscle enough time to contract and extend. As you can see, this is working on your quads and your hamstrings. If you feel both legs are hurting, then you can do the same action using the both legs together. We'll show you how. That's it. Extend both legs and pointing your toes down, bring them down. Extend them, flex your feet. There you go. Point them forward and flex them in. Flexion and extension. Very simple but very effective. Now moving on to the third exercise, here you can have a towel which most of us have. If you can find a ball which is also good, which is available everywhere. Now place the ball directly under the knee joint. Either seated or lying down, whichever is comfortable for you. As you can see, using full resistance, press the ball to the floor and automatically your leg will be extending and flex your toes towards your belly button or your kneecap and hold it for 10 counts without holding your breath and gently release. Continue doing it for 10 times. Every time you are squeezing the ball, as you can see, when you are squeezing, automatically the leg will be extending and you make sure you are flexing your toes towards your kneecap without holding the breath. Hold that pressure for 10 counts and release and continue doing it for 10 reps. And if both the knees are in trouble, after this you can shift the ball to the other leg and continue to do the same workout. Now let's move on to the fourth one. Now take the ball and place it in between the knees. Either seated or lying down, whichever is comfortable for you. The feet placed comfortably on the floor, hands at the comfortable level and press both the knees in, squeezing the ball. So this will help to contract your inner thigh muscles And like I said, only hold that pressure but don't hold your breath. Keep breathing. It is very, very important to supply oxygen to the muscles. So focus on breath work and give good pressure, and after 10 counts you release the pressure. And once again continue doing it. As you can see, the medial structure of your leg is getting worked out. Most focus on the inner thigh, and continue doing it for 10 reps. Every rep you have to hold for 10 seconds, making sure you are properly breathing. And let's move on to the fifth exercise. You can release the ball now. Lie down comfortably and bring the legs into L shape. This is perfect. Don't bring the knees more inside. Proper L shape, and don't drop the heels down. Okay, from this position, extend the legs to the ceiling. If both knees are hurting both legs, or if one only you have a problem with one leg, continue doing on the leg that is troubling you. So extend using resistance. Just don't lift and drop randomly. Just use the resistance. Extend and flex your feet and release the feet and bring them to L shape. As you can see, this action works on your quads, flexing your feet, working on your calf muscles, and release and bring them to L shape. Focus on breath work and continue doing it for 10 reps. So these exercises act like medicine, and you will see a tremendous improvement for yourself within a week. So precautions: don't go for prolonged standing, avoid climbing up, don't use Indian toilets, and don't sit on the floor in a cross-legged position. And do regularly and see the result for yourself. Anybody suffering with chronic pain, you can do this thrice in a day. And depending on the pain, if it is a moderate, twice. And if it is in a starting position, a must exercise every day. So this is it. Any views, any doubts you have, please do get back to us, or you can visit us personally if we are in Hyderabad. Bangaloreans, please follow us and post us your comments, and we